Hello. Okay, y'all. Okay, I'm under the weather. Um, I can't even tell you what is going on because I don't know. All I know is, um, I woke up yesterday morning. Let me see. I woke up at 3:50 and had to go to the bathroom, but I wasn't able to go back to sleep. So I stayed up, and around 5 o'clock, my chills started real bad, shivering, teeth chattering, everything. So I managed to take my temperature. It was 100.5, and I got the Tylenol out. I didn't take it just yet, but I wanted to make my tea. So I made the tea because I needed to stop shivering. I did not want to turn on my little space heater. One, it's not cold enough for that. But I didn't need to turn it on. Um, so I got the tea made. So I took the Tylenol and then chased the water from the Tylenol with tea so I can stop the chills. It took 16 minutes for those chills to stop. And then I called my oncologist office to let them know, because I'm not going to go to the emergency room. Let's get that. Let's clear the air. I'm not going to go. Not at all. The emergency room gives me anxiety attacks because there's germs. I can't fight it off. Y'all, I can't even tell y'all what I have right now. All I know is it's leaving my body. My body is fighting. And y'all know all the ways your body fights stuff. That's what my body is doing. But I can't tell you what's wrong. I can't tell you what hurts, where it's at, nothing. That's what I'm scared of. But now today when I woke up, my throat was hurting and this ear starting to feel funny. So I'm like, oh, okay. I might have an ear infection. The only difference is, since most of that stuff is kind of sinus related with the sinus drainage and all that stuff, and I still sleep at an angle. I still sleep with my body pillow. So let me go over here. Hold on. Okay, so yeah, I forgot what I was saying. I ain't gonna lie, this scam chemo brain gets on my nerves. And I thought I had something up here to prop you up on. Wait a minute. Okay, it's just not high enough. It cuts off my head, but we all know my head is still bald. um, Anywho, so yeah, I'm extremely tired though. Um, it's the other thing. I don't feel like doing anything, and I'm not. Um, yeah. So that's the ugly side of cancer. This is the ugly side. And I'm glad I'm making this video. And I'm going to make myself post this video. Because everything is not peaches and cream. The weather change is starting to get colder. And yeah. So I don't have no control over that. But it's not gonna stop me from getting sick. Because I do suffer from sinuses. So the only thing I don't like about this is, yes, the weather changes, but y'all know with sinus drainage, you usually get like the headaches and the runny nose and all that stuff. I don't get that stuff because I'm sleeping at an angle. So I guess my body's way of telling me about my sinuses is these fevers. The last time I was running a fever, it was 102. And I called and talked to the on-call oncologist at that time, and she told me to monitor the fever, and if it gets any higher or if my symptoms change, to go to the ER. Yeah. But the next day when my oncologist office called, the nurse called me and said, "You should have went to the ER." I said, "Well, my oncologist co-worker said." And y'all know I'm not going to no ER. So whatever it is you want me to do, you need to let me know. Because I won't go to the ER. I will go to urgent care, or I will go to my primary care doctor. But you need to let me know what it is they need to do. See? Because I'm not going to the emergency room. I will not. I understand I'm a cancer patient and they will take me straight back. But I can't fight anything. I can't fight off anything. I can't fight off everything. I can't fight off nothing. All these things, I can't fight them. I don't want to go to the emergency room. And the one that's closest to my oncologist's office, they see quite a bit. I don't want to go to that. I don't want to go. Nope. Just tell me what you want. I will do it. But I will keep track of the fever myself and trust. I monitor my fevers every 4 hours. But I'm going to show y'all my blood work. And yes, you should keep track of this stuff so you can see where you at. I gotta go in between some pages. So, because I also mark down how I'm feeling on the days in between chemo treatments. What is that? Yeah, I write down how I'm feeling in between treatments because and let me get let me see. So what I'm gonna do get a page that don't have anything on there. All right, I'm gonna go to my calendar page. And hide these. Can I put that in there? Okay. Yeah, I can. I'm gonna have to cover that one up. Okay. Okay. These are in no particular order. Yeah, I think I done mixed them up. And I'm gonna try to get this other one out so that y'all can see it. Because since I'm not feeling well, I did get my blood work drawn yesterday. They did not advise me to go to the hospital. Ha ha ha. But they did what did she say? Yeah, if I couldn't get my fever under control. But I was able to get it under control, and I monitored it. Because I said, look, okay, I understand you want me to go get labs, but if this fever is not dropped, I'm not going to the lab. And I will know because I get all, I mean, my temperature in the 4-hour difference, my temperature needs to be taken before I get off work, an hour before I get off work. So I am going to take my temperature before I get off work. If I'm running a fever, I am not going to go get the labs done. I'm not going to go. So there's that. Sorry, you have to look at my hand. I'm trying to put this down here. Will that not go there? What is going on? Hold on, y'all. Okay. Now we're back. So now we can go back to these again. Look at these numbers. And they're all going to say abnormal final result at the bottom. They're all going to say that. Now this is the one that I just did yesterday. And you want me to tell you how I know? I can tell y'all. Because I'm right where you need to look to know there's something wrong. So if you look at this and this, and this, and this, you can tell something's wrong. And let me see. I'm going to point out the first number. That's how you know something's wrong. So, okay. There are other factors in there that tells you something's wrong. But the number one The very first one that my oncologist was looking for was the white blood cell count. That tells you something's wrong. And because he stressed about wearing a mask, which I said, you ain't got to tell me twice. You know, I watch thousands of YouTube videos with cancer patients. And yes, I understand all of us don't have the same cancer. Nothing is the same about us. Nothing is going to be the same. Y'all know what I still ain't found nobody who had the same surgery as me. Go figure. There are women out there who have had Goldilocks procedures, but there's always something different. So let's just keep it all the way 100. Okay. So, all cancers aren't the same, and they definitely aren't treated the same. There is a whole bunch of factors that go into the type of chemo that you get, why you get that type of chemo. Yeah. So, y'all, I think if I was getting any more chemo treatments than what I'm already getting, I probably would have refused treatment or tell them to figure out a way to extend it and give me shorter infusions. I'm just being honest. Because refusing treatment can cost me my life. And I don't want to be that selfish to my parents, my daughters, my grandkids. But nobody knows what you're going through except for me and God. I'm tired. I am so tired that it feels like no amount of sleep that I'm getting is enough. That's how tired I am. And it's sad. It's sad. But yeah, I'm tired. I just don't want to do it anymore. But I can't give up. It's too many people counting on me. I'm so tired. And then just to think, it's not only dealing with this, it's the stuff you have to deal with outside of this. Ugh. I'm just gonna pray. Just gonna pray. Just gonna pray. But yeah, it's and y'all know it was some extra blood work that they did yesterday too. So I already know to expect a call from my oncologist because I've already made it clear that I was not going to the emergency room. But if he wanted me to go to my primary care doctor, I will go and have them check me. And remember, I had just took an antibiotic for my sinuses. And yeah. Okay. That caused something else. So, yeah, go figure. But I don't know. I'll probably go to have them check my ears and my throat, because I'm not sure how strep throat or ear infection would be like with chemo in my system. Let's put it that way. Yeah. I don't know. I know everything is different though. I do know that. I'm not happy. I'm not happy with this at all. Y'all, I'm ready to get it over with and look for better days ahead. Cause my arms, I look like I've been shooting up. And look, my can y'all see that? Oh, y'all can't see that? Oh, y'all see that? Yeah, and then I got, I don't know what this is. Yeah. So my arms are bruised. Matter of fact, I needed to. Okay. Yeah. So when she drew my blood yesterday, my arm was sore after that. But I'm thinking it's because I wasn't feeling good. But I technically was. But the way she explained it to me, because I'm like, okay, I took my temperature at 2. You know, I get off at 3, but I took it at 2, and I had a normal 98.4. So, but she was saying, okay, but the last time you took it, it was a low grade, what they consider low grade, 99.7. You may have something you can't see. And I'm like, why sinuses is the only thing that I deal with. I don't come into contact with people. I work from home. So, you know, in my family that I deal with, I don't deal with them often. Let's put it that way. Because when they're coming to check on me, most of the time I'm probably asleep or laying down, just, you know. So there's not that close contact because I mean, let's be honest. I be tired. I work work a full day, and to try to get myself, it's the energy. I think that's what it is. It's the energy, and I don't have it. I have enough to get me through the day, which is the B12 that I added, that's what it does. It gives me enough energy to make it through the day. And by the time I get off work, I feel like I've worked a double shift. You know what I'm saying? It's, ugh. But, I don't know, y'all. I don't know. I need to get my tea, though. Hold on. Goodness gracious. Look at that. That sun. It's good. But you can really see. Look at my hair, y'all. You can really see it. Now, that little dark outline that y'all see, that's the dark hair. So, I don't know if you can see. Let's see how much y'all can see in the sun with this head. Not sure. You can see her. But yeah. Sun is good, but it's too hot. It's too hot and I'm tired. So don't feel good. So I'm not gonna enjoy it. Drink me some tea. I do need to wash my car. Cause we got a privacy fence put up. And this unprofessional motherfucker got some shit on my car. And I am pissed. One, I took my car to the dealership right before I had chemo. So 2 days before I had chemo. Chemo brain. I can't remember, but it was right before I had chemo that I took it in. And I didn't know. Yeah. Hold on. Okay. I'm all over the house today. So you don't know what you don't know if you don't say nothing. My saving grace was when the guy approached my car when I took it to the dealership to get the regular routine maintenance, the oil change, tire rotation, all that stuff. So when he approached the car, I had on my mask and I was like, I'm not sick. I am a cancer patient. And he said, okay, let me get your representative. My representative, oh, look, y'all. Oh, the dark circle it's only appearing up under that eye. Why it look like I got a black eye? Ain't nobody abusing me, y'all. Ain't nobody putting their hands on me. Not in no bad way. So my service center rep was like, did I hear you say you had cancer? And I'm like, yep. And he said, I'm so sorry. My mom lost her battle with cancer. He said, so this is what I'm going to do for you. Because you don't have to sit here. I am going to call you an Uber. It's on us. It will Uber you back home so you don't have to sit in our waiting area, which has way too many people for you to be sitting in. So I want you to be comfortable because I want you to be able to, because y'all know the dealership got all those refreshments and snacks and stuff. So he's like, I want you to be able to do that comfortably. Get your snacks before you leave here. And the Uber they will text your phone when they're outside, and you know what car to look for and what your driver's name is. So yeah, but yeah, sent me home. And when my car was finished, they picked me up. But they also, now mind you, y'all, my car it's been sitting for 2 months. Nobody thought to start my car while I was having surgery because they weren't worried about my car. They was worried about me. So it didn't get started until I started it. And then I started driving. Well, here we are. I'm a month behind on service. And I explained to him, said, I apologize. This car was supposed to be here last month. So I'm bringing it to you now. And but the day that's set up for me to bring it, I was on that sticker. I was having chemo that day, so there was no way I could get it to you. He said it's okay. And he said, I'm so sorry that you're going through this, but I thank you for being a fighter. And he asked if he can give me a hug, and I said, of course, I said, you ain't the first and you're not going to be the last. So, but yeah, it is a hard fight. I will admit that. It's hard. And they also washed my car for me because he said there was a lot of spider webs on your car. We ran it through the wash twice. Thank you. My car was clean. It was so clean, I parked it on the street. Not in the driveway, on the street. Because I knew, the privacy fence was getting installed. And we was getting the tree cut down in the back. But the people who was cutting down the tree needed the spot where my car was. So, put it in the driveway. All of that to tell y'all about all the stuff that's on my car right now. It is so dirty. You would think that I purposely drove through mud. My windows are covered. I tried to use the windshield wiper fluid to clean off my windows. Needless to say, I'm pissed. So when I went to get my blood work done yesterday, I thought maybe I should have went to the car wash, but it was too much traffic and I wasn't feeling it. And I'm like, yeah, I'm not going to push myself to do anything right now during this time. Because I don't know what will happen. And the reason I say that is because it was extremely humid. Yesterday, and even though I rode in the air, I still don't know what will happen. Especially going outside. Yeah. No, I don't want to take any more chances. So I'd rather just be safe than sorry. I wasn't feeling good. I did grab me some soup, and brought myself on home. So, but previous experience being out in the humidity before cancer, my nose would bleed. So, yeah, I don't want to go through that. I don't want to go through that. I don't want to go through any of that. I need to. Okay. Y'all. I'm checking. I got this scratch on me and I was just checking it just to make sure. But it's okay. It is healing. These nails, I've been trying to keep them short, y'all, because I've been scratching myself. Not, y'all know. But been scratching myself. So, but yeah, I do need to eventually get my car washed. So I gotta get that done immediately because I want to make sure that that stuff comes off of my car because they just finished the fence. So I'm like, yeah, I need to go to the car wash to get my car washed. Because if it don't come off, you calling them motherfuckers back and they need to figure this shit out. Okay? Because you can't come to somebody's house and tear up somebody else's stuff. So this is probably number 1010 why I will not get a new car anymore, because other people will tear up your stuff because it's not there, so they don't care about it. But the fact that this ain't the only work that you've done, and yeah, but you knew that I've been battling cancer, so I'm not going to always come outside and be, why do I have to come out and look behind what you are getting paid to do? Yeah. So that's the other BS that you got to deal with. Anyway, I'm tired. Tired. And I've been trying to keep myself hydrated, but I'm not hungry, y'all. Like, not hungry. I've been drinking tea though. I drank that throat tamer tea because my throat was bothering me. Yeah, because I can tell that my sinuses were draining because my voice is kind of, yeah. But appetite, I don't have. So we will see in the days to come what this comes out to be, because I have a week before chemo starts again. Well, I got to get my blood work again for it and see what it says. So, we'll see. So, we'll see y'all in the next video. Bye.